going to talk now about how is noncompliance detected. Well, it's really a violation of everything. Company policies, statutes, Anti-Kickback, False Claims Act, Stark, High-Tech, HIPAA, all of those things. And it's also violations that relate to complying with your private insurer contracts, Blue Cross Blue Shield, Aetna, United Healthcare, whatever those might be. It's also a violation of your own policies. When you create policies or guidelines, they don't have the force and effect of law, and violating them doesn't get anybody in trouble. But there should be set up by you to ensure that you comply with the actual standard of the actual law, right? It's your way of saying, anti-kickback says that you cannot pay or receive remuneration for referral of a healthcare program or a healthcare beneficiary. Well, how do you enforce that? What does the average person think that is? What's remuneration? Well, you say, well, it could be anything. Get a coffee cup. It could be remuneration. It depends. Or it could be somebody paying $200 for your dinner, or a night out at the opera, or whatever those things might be. But they need to be brought down to the employees' level so they can clearly understand those types of things. How is it detected? The big one up there is the whistleblower. Most people are turned in because you fired a disgruntled employee that knows where the secrets are hidden. They run and they file a Qui-Tam. A Qui-Tam goes all the way back to 1876, and it basically means on behalf of the king. So an individual can file a lawsuit on behalf of the government, and here's the incentive for that. If the government picks up the case, they go all the way through prosecution, the person that files that can receive between 15 and 30% of the proceeds. And there have been some big checks. Let's say the government recoups $200 million. That person could get $60 million for turning you in. So there's an incentive for people to turn you in. So when you're doing these exit interviews, use your intuition, have your human resource, have somebody really gauge this person as to whether or not they're, one, discontent, which many people are if you fire them, but two, what do they know? Now, some people have non-disclosure agreements. That doesn't help when you're talking about violating the government. You can always turn somebody in for violating the government. You can't have a contract that prohibits somebody from informing the government that you've been stealing money from them. The other way is a management report. You have to look at those. You can see things in there, and it might be identified. A hospital division, intake division. You might see in the marketing report that they've hired some new people to do marketing, that they're paying on a contingency fee basis or something, or they're giving them a bonus. You might see in a report that, these 5 outstanding marketing people received an extra $50,000 or $40,000. That ought to pique your interest. And say, well, how did that happen? It might be legitimate, but maybe it's not. Somebody really doesn't know it's not to do that. It can also be an initiation of a government investigation. And the government investigation comes in a number of ways, but here's the sneaky ways. Somebody files a Qui-Tam, the government will send out to you a civil investigative demand. It looks like a subpoena, but it's really not a subpoena. And it says things like this. The government's investigating some blah, 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 blah. We would like your cooperation for blah, 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 blah. And could you please send these records and these records that might be related to something else? Well, don't be fooled by that, because it's probably related to you. And hire an attorney immediately, because that's the beginning of a civil investigation that may turn criminal. It only turns criminal if there's intent, but it may. So a civil investigative demand is a real interesting thing, and one you ought to be concerned about. It can also happen by a subpoena. It can also happen when 3 o'clock in the morning, the FBI shows up and shuts down your clinic or your nursing home, and they take all the computers and they do all of these kinds of things. So it can be the outlandish of the FBI showing up all the way to a civil investigative demand by the government. It can also be a request for records by the insurance carrier, and that's pretty benign, and it's hard to distinguish those because sometimes the request is simply this. They return a couple EOBs that have some problems. They say, hey, we'd like to see the records on those EOBs. Well, you think, okay, that's cool. It happens all the time, and you have to send those records. And then they send back, they say, well, thank you very much. We'd like to see these 14 or 15 records. Now you're starting to get into some trouble, and compliance ought to look at those records and figure out what's going on here. Is it a simple overpayment because the wrong modifier was used or whatever, or are we looking at something more serious? Because often the next one is, could you send us these 200 records? And people start looking, well, why do they want these people? Oh, they randomly pick them. Well, I don't believe that very much. I want to look at each one because there may not be any randomness at all, except they all were going through the same issue. You also have non-compliance can be found through your routine audits. And that's where it should be found, and that's what we're going to talk about. The idea here is to beat the government, beat the private insurance carrier to finding the problem. That's what compliance is about. That's what internal investigations are about. The initial steps to detecting fraud are reporting it to your compliance officer, documenting the complaint, and then continue with an investigation. And here's where the problems come. Things aren't clearly reported because somebody's afraid to report it. They're afraid of their job. They're afraid of this. They call a hotline and nobody responds to the hotline. They get frustrated. Their supervisor tells them not to do this. They're afraid of their supervisor, so they want to go up the chain of command. There's all of those issues. Or it is reported, but it's not clearly documented. Somebody doesn't put the same serious twist on it that ought to be there. And then, of course, it's not investigated. You have to have all three of those.